But we're very pleased to welcome our newsmaker of the day. This is our opportunity to go behind the headlines of the day in our community, get a little more insight, maybe even get the actual information for us properly, because sometimes when you read these articles, they bury the lead, that kind of stuff. And it's a rare treat for us to have our newsmaker in studio with us. We're very pleased to welcome to our conversation this morning Michael Silverman. He is the executive director of the Transgender Legal Defense and Education Fund. Good morning, Michael.
Good morning.
Thank you for joining us.
Absolutely.
Such a great pink shirt.
Thanks very much.
Very bright. Well, because we're having a rainy day in New York City. Hopefully it's sunny where you are. But so any burst of color is welcome on this kind of day.
It's dreary out today, and the subways are running slowly.
Are they?
Yeah.
Well, for folks who haven't heard, this is really, really interesting and very, very heartening. The Transgender Legal Defense and Education Fund is going to hold its first ever Transgender Health Fair on Wednesday. This is going to be happening June 6th in Manhattan here in New York City. Now, is this the first of its kind? I don't recall hearing about this in the past.
This is the first of its kind, and it's really exciting for us. You know, a lot of people sort of don't think about healthcare as an area where people experience discrimination, but for transgender people, the healthcare system is just a minefield of different types of discrimination.
I can't imagine what it would be like to be a person who is either transitioning or has transitioned and trying to find a doctor. And, that interview process, even for a person who isn't experiencing these kind of physical scenarios, just going to the doctor on a daily basis is really hard. If you're transitioning, it's got to be harrowing.
It really is. It starts, right from the moment that people enter a healthcare facility. You're faced with intake forms that say M or F, male or female. And for a lot of people who are transitioning, that is a fraught choice.
Well, right, because you have to decide whether you're going to answer based on who you are in your soul or what you were born with.
Absolutely. And what are the consequences going to be for your insurance? What are the consequences going to be for, say, Medicaid? If you're on Medicaid, how is that going to play out down the road in the hospital when you're trying to interact with doctors and nurses as, say, who you are or who you're trying to be, and versus what's on that intake form.
So do you find that a lot of transgender people just bypass having any kind of regular health care? Not about in terms of their transitioning, but just for basic health issues.
Yeah, I mean, one of the things that happens is, look, healthcare is an option at the end of the day. If you feel like this is going to be too much, I'm going to be mistreated, I'm going to be harassed, I'm not going to be recognized for who I am, one can just as easily check out of the system. And we see that all the time, and we see really poor health outcomes in the transgender community, which of course has repercussions for things like employment. If you're not healthy enough to work, well, then you're not going to be a great employee. And that, these things tend to be circular and feed off one another.
Yeah, talking to Michael Silverman, the executive director of the Transgender Legal Defense Network and Education Fund. And as we mentioned, there's going to be the first ever Transgender Health Fair on Wednesday, June 6th here in Manhattan. Is there any opportunity for this to happen around the country at a different point?
Absolutely. We have worked for years with healthcare providers here in the city to try to ensure that there are places that transgender people can go and receive what we'd call culturally competent and sensitive care. And we've been really lucky to be able to work with St. Vincent's here in Manhattan, which would surprise a lot of people because it's our huge local Catholic medical center. And they have absolutely embraced this cause and have, taken upon themselves to ensure that their hospital becomes transgender friendly, transgender supportive. I think what people around the country need to do is work with their local healthcare providers, raise this issue, because, while there is a lot of hostility and discrimination towards transgender people in the healthcare system, there are also a lot of supportive people who want to do the right thing,
right,
who may just not know what the right thing is.
And isn't it really a matter, in some cases, when we have people who are transgender listening from all over America, people seem to think that it's something that's inherent in urban America. But we talk to truckers who are transgender, and they're in the deep South, they're in the heart of the Midwest. Isn't it, in some cases, just a matter of making sure that your doctor is savvy about the issues that transgender people deal with? Because my guess is that if a doctor is in North Carolina or Wyoming or in Wisconsin and he's been practicing or she's been practicing for 20, 30 years and haven't had to deal with a transgender person, they don't necessarily even know what the issues are for transgender people? Is it really, sometimes is it just a matter of making sure the doctor is smart enough or updated on what's going on?
Absolutely. I think the issue you're talking about is really somebody finding a primary care physician who is supportive, understanding, up to speed on the medical needs of the patient is incredibly important. But the healthcare system is actually a lot bigger than just one doctor, and people are often referred out. People often need to go to hospitals. So it actually requires a lot more work and a lot more training for a lot of people beyond just a primary care physician. I'll give you an example of a case we're working on in our office now that implicates the healthcare system. We had 2 transgender people, right here in the New York City area who went to an emergency room, and they were berated by hospital staff. They were called faggots. By hospital staff. Can you imagine going to the emergency room at a hospital and that is what you're subjected to?
Oh,
and
my
why
gosh.
would anyone go back? Why would anyone think oh, I can go here and be treated for what ails me? No, you're going to go there and you're going to be treated like garbage.
Oh.
Now, I give that example to just point out that it isn't as simple as finding one good doctor. The healthcare system is much bigger. There are a lot of people in it. There are security guards, there are maintenance workers, there are front desk staff, there are records office people, all of whom play a part in the healthcare system, and all of whom really need to be aware of the diversity of the communities that they serve.
It's so crazy to me that we even have to have this conversation, because you just stop and you think, didn't your mama raise you just to be polite?
It's remarkable. I mean, some of these stories are so shocking that I sometimes can't believe what comes into our office. But this is what people are faced with day to day. There's no explanation for it. There's no excuse for it, for that kind of treatment. But that is, unfortunately, one element of the kind of harassment that transgender people really do face.
It's just shocking and heartbreaking at the same time. Talking to Michael Silverman, the Executive Director of Transgender Legal Defense and Education Fund. And again, there's going to be a health fair for transgender people at St. Vincent's Hospital here in the New York area on Wednesday, June 6th. So now, what exactly is going to be happening at the health fair?
We are going to have providers from St. Vincent's, from the Callan Lord LGBT Community Health Center, from a bunch of other local healthcare and community social service providers, providing services to transgender people. I should just point out that the health fair is at the LGBT Community Center.
Oh, it's at the center. I apologize.
Yeah, that's all right, which is right around the corner from St. Vincent's
It is
for anyone
indeed.
who's local. And it's going to be an opportunity for transgender people to interact with supportive providers, to get screenings and testings for things like blood pressure, cholesterol, to set up appointments if they want to go to St. Vincent's after and have an HIV screening, things like that.
Right.
And to know that there will be supportive services. We're also making a special effort to ensure that there are what we call sort of sex-specific services available, so that there will be transgender supportive prostate screenings, the things that are really geared towards particular kinds of anatomy, where somebody who, for example, who looks female might feel awkward going, for example, to a prostate screening. Someone who looks male might feel awkward going for a gynecological screening. So we want to ensure that those services are available to people as well.
Because it really is just a terrifying thing to just take care of yourself for some people. When you feel like you're not going to be treated well, or you feel like people are just going to look at you like you're odd.
Yeah, there's a wonderful documentary called Southern Comfort, which tells the story of a transgender man called Robert Eads, who lived in fairly rural part of Georgia, and he developed ovarian cancer and went through calling 20 healthcare providers, none of whom wanted to treat him, because this was primarily treatment for biological women. And they were afraid that this would, having a transgender man there with these body parts, would offend their patients and whatnot. And ultimately, he died from the cancer after going through. He ultimately found, the 20th provider said, yes, I'll treat you. But
it's just tragic. It's just tragic. So for people who are not going to be in New York on Wednesday, but want to learn more about the Transgender Legal Defense and Education Fund, what's your website?
www.transgenderlegal.org.
transgenderlegal.org.
Correct.
And of course, we also recommend, they're not connected, but you should also always keep in mind that there's gayhealth.com, which is an excellent resource for medical care around America. And we really thank you for coming in this morning, Michael.
Well, thank you so much for having me.
Please keep us in the loop, and we want to help you spread the word about your future projects.
We appreciate it. Thank you so much.
Thank you so much.